We do advocacy around issues like healthcare, economic stability and mobility, and racial equity. So that's a snippet of what we do in like 3 seconds.
30 seconds. Great job. Great job. Thank you. And then we have Rebekah Morgan with us, and Rebekah is the Director of Social Services in Middlesex County, which is near the Northern Neck in Virginia. And Rebekah is also the Director of the Legislative Committee for the Virginia Association of Social Service Directors. Welcome, Rebekah.
Thank you so much for having me.
You are welcome. Our discussion leaders, Casey Cunningham is the Policy Director for the Children's Home Society in Virginia. Casey, do you want to introduce yourself or add a little bit more to my introduction?
Sure, absolutely. I'm glad to be here. So as Senator Frola said, I'm the Policy Director at Children's Home Society. I lead our advocacy work, but as an agency, we also do adoption from foster care. We have some post-adoption supports for families who do adopt from foster care, and we also have a program called My Path Forward that works with youth who have aged out of foster care, helping them transition into independence.
That's great. It's really important. And then we have John Horsch, who is the founder and director of SALT, which is a social action linking together network. It's a volunteer group of individuals who care very passionately about our most vulnerable citizens. SALT has been a very effective advocate for our children and families. John, do you want to add anything to that description?
Well, we've given grassroots a good name, so and we're kind of started faith-based, but we advocate for common sense social policy. So that's us.
You advocate for solutions. That's great. Thank you, John. And then we have Amy Wilker, and Amy is with the Northern Virginia SCAN organization, Stop Child Abuse Now. And Amy is the director of the CASA program for Arlington and Alexandria. The CASA program stands for Court Appointed Special Advocates. And Amy, welcome. Is there
anything for having me
you would like to add, or?
No, I'm thrilled to be here amongst all these wonderful advocates for children who are in care or have been abused or neglected. So anything we can do to improve anybody's situation, I'm all for it.
Well, I think we've got a powerful group together, and we will make a difference. I'm going to start with Tiffany. Tiffany, you're with Voices for Virginia's Children. Would you like to give us a 3 to 4 minute thumbnail sketch of what you think the problem is with the foster care system and how we should go about correcting it?
So, okay. So currently, I know that Virginia Department of Social Services is actively working to address some of the needs of children and families. But with this knowledge and my professional and lived experiences, I know that there is still work to be done. So currently, this system does not adequately address the needs of parenting youth, undocumented and immigrant youth, and youth with serious criminal history and transition age youth. Personally, I can speak to some of those issues or categories of young people, but the one in regards to the serious criminal history, I cannot speak to. I can only anecdotally speak to that issue. For me personally, some barriers with being a teen parent or a young adult with a child in the foster care system was childcare. And it also, another barrier was employment and educational barriers. like assistance with childcare so that I could complete that, as well as maintaining or attaining my documentation status so that I could begin my employment career. Another one in regards to immigrant and undocumented families is language access, healthcare access, and as well as employment barriers due to documentation and educational barriers like in-state tuition while attaining in-state tuition, or maybe even just creating an extensive grace period so that this allows for proof of documentation to be provided to access like in-state tuition or educational resources that other foster youth would otherwise have access to. Another thing that I would like to bring to face is housing and workforce development and healthcare access. So we already know that about 1 in 4 youth who transition out of care end up homeless within the first 18 months of transitioning out. So I would like to, well, I know that there's work being done around improving the system as far as workforce development and education access and development. But there is still extensive work that needs to be done. As far as, I'm so sorry, I'm so nervous. And I tried to write down some things. I had a lot prepared, but yeah, I think that's some of that. So employment and education, that's one area. Healthcare access is another area, and language access, as well as access to legal services so that undocumented youth can attain legal status and receive the full benefit of being involved in the foster care system.
Well, those are big challenges, and there's sometimes challenges that are overlooked. So thank you for bringing them to our attention, and we will have a robust discussion about them. Before
Are those clear?
Yes,
Okay.
you did a very good job. So it was a great presentation. Rebekah, you're boots on the ground. You're the director of social services. You've got child protective service programs under your direction. Why don't you give us some insight on how the system actually works, especially with students who are undocumented or may otherwise not be able to access services, but they need services.
Absolutely. And Tiffany, you did a great job. So please don't be nervous. I am just proud that we have a child formerly in foster care on here. It's so important to hear your voice. So thank you. Thank you. I just wanted to talk just about a couple of things. And I really think one of the major barriers and boots on the ground perspective comes before a child even comes into foster care. We have the ability to really engage with kinship caregivers and or fictive kin, maybe a neighbor, a teacher. But sometimes we're not able to get through the bureaucracy of our system to really engage those folks who are so important to a child, to make sure that if a child comes into foster care, they know who their parents are, their foster parents are. Tiffany did reference the barrier crimes. That has been an issue for many years. We have relatives, and I'll give you an example. I had a child who I wanted to place with his uncle. And unfortunately, the uncle, I think 25 years ago, had committed a barrier crime and had not had any criminal history since. But unfortunately, we were not able to place that child with that relative. And there was no one else. And so the child ended up in a group home. And that certainly was not an outcome that any of us working with this child thought was best for him. Another barrier we have, I think sometimes, especially for kids who come to us when they are teenagers, if we as a system had identified those kids, 5-10 years earlier, we really could have put services in place for both their families and them. So I think we need to do a better job as a community as a whole at engaging our partners and a prevention framework across all human services agencies so that we are all connected to families and children in need in our community. And I know that there is some work being done on that front, and I think that that would truly make a difference. I also wanted to just briefly touch on navigating through the system as a fictive kin or relative care provider. The forms alone, the acronyms, it's like speaking a different language for someone who has never worked with the system before. And especially for undocumented youth, accessing services when they may not speak English as their first language. And then we're asking them to learn, in addition to English, all of these acronyms and what does it mean. And even when we provide good casework, I believe that if we had someone in a kinship navigator program, for instance, holding hands with that family and walking them through our system, that we would have better outcomes.
This is great presentation. And some of these, I think some of these challenges we should be able to address. So you gave us a lot of, good things to think about, or things that I believe we can somehow correct. The discussion leaders with us, Casey, did you want to talk a little bit about your perspective on the Children's Home Society, or would you like to offer a solution to some of the problems that have been so aptly outlined by Rebekah Morgan and also by Tiffany Haynes?
Yeah, I think Rebekah and Tiffany, everything you said, I completely agree with. One of the big things that we work on is youth aging out of foster care. So kind of that other end of kinship and prevention, which I know we've done a lot of work on recently, particularly with the General Assembly, and I'm so appreciative of that work. But I think one of the struggles is just there are so many kids and youth that we need to help. And there's the prevention side, and then there's all the way over to aging out. And it's hard to continue to focus on all of those different areas because every child and youth that enters the system has a different circumstance, right? They all come from a different background, a different family, they have different connections in the community or lack thereof. So I think it can be hard when we have these conversations at the policy level to remember that there is no one size fits all solution. And something that we've talked about a lot, I know with you, Senator Favola, and also with the League of Social Services Executives, and I'm sure Rebekah can talk more about, is just the turnover for caseworkers in the state. Just needing significantly more funding because I do believe every caseworker really wants to do their best and wants to help these children and youth. But there isn't always the time when you have high caseloads and minimal pay. And so I think focusing on really increasing that ability and that capacity to provide each youth with what they need. This is not easy work that you all are doing.
It's not.
I'm at the policy level. I'm not boots on the ground, but it is not easy work that you all are doing. And what I always think about, particularly with youth who have aged out of foster care, is I reflect on when I was 18 and 19 and 20 and 21, and how much I relied on my family. If my car broke down, I called my dad. If I needed help applying for funding for school, I called someone. And so if you think about all of the things that you need to help support you to the point that you can be independent, it's a lot of work. And these youth deserve that support and that help. So I think that a lot of it really does come down to just funding so that we do have the ability to really support these youth the way that they deserve.
And to support them for several years after they age out of foster care. And we did pass Fostering Futures. It took me a couple of years to get that through the General Assembly, but that does allow foster youth who create a plan before they exit the foster care system, if they can create a plan that discusses education or workforce development and has a pathway forward, they can continue to receive financial support until they're 21. And then, of course, they can stay on Medicaid until they're 26. I believe that I think the financial support probably needs to be extended beyond 21. And I would like to work with the federal, our federal representatives to get federal money for those, maybe those years between 21 and 25. It is absolutely critical that, as you said, we provide a focused approach to every foster youth so that foster youth can succeed. About 30% of our homeless population were former foster youth, and folks don't know that. And that's a classic example of, if we could provide the needed resources, guidance, and support up front, we could actually reduce a tragedy such as becoming homeless. So thank you. And we're going to continue. We're going to get back to some of the comments you've made. I'm going to go to Amy Wilker. Amy, you are the court-appointed special advocate expert and director for the SCAN program under the SCAN rubric. What thoughts do you have on the foster care system?
I definitely echo everything that the panel members have said. One of the biggest challenges I also find that for our foster youth at all ages is trauma-informed mental health services. There is a severe lack of services for any of our children being removed from your home, the abuse and neglect. That's a trauma, and we see it all the time. We don't know when that trauma is going to surface. We don't know. It could happen. They could start tomorrow. It could start next month. It could start 5 years from now. And a lot of times that those behaviors go unrecognized as behavioral issues and not trauma related. And that creates another cycle for our children that create a barrier to educate, equal opportunities in education as they start to grow older. I am incredibly passionate about servicing our older youth. I've had experience working with older youth elsewhere that were able to really access true independent living services that included housing, support for education, access to medical care, mental health care, job training. And the outcomes for these youth are so much higher. Senator, you mentioned the percentage of people who get into the prison pipeline that were former foster youth. Recently, we're looking at some numbers. If all of the children in Virginia who were in the foster care system or involved in child welfare graduated high school at the same rate as their peers, their annual income would be increased by over $9,000 a year. But more importantly, they would have access to a better life for themselves and their families and leading independent life. And for anybody who is not really sure whether there is a benefit to that, those individuals will also contribute close to $7 billion to our tax base. So it's a pay me now or pay me later situation. And I really believe that if we invest in our youth now and help them with those services so that they can become self-sufficient, independent adults with adequate services, and particularly, like I said, that trauma-informed mental health services, they are a part of our community. And that's what we want them to be able to engage in our community.
Yes, I absolutely. We have a very much a societal interest in helping our foster youth succeed. I just, for the record, I don't know the percentage of foster youth that may end up in prison. My statistic dealt with homelessness. 30% of our homeless individuals are foster youth.
It's close to, I think, 70% of prior foster youth Some get into the prison system by the time they're 25.
Well, that's a real example of how we need to change and shift the way resources are allocated. John Horsch, you
Hey.
are the advocate. You're the one that talks to lawmakers all the time with passion and persistence. So what would you like to add to this conversation?
Well, everybody has spoken well, and I'll try to match them. It's Forbes magazine ranks Virginia #1 for business, but we're not so for kids, and we have the resources to do better. So anyway, I just let me see. One thing I wanted to share or to promote is parenting programs. They indirectly help these children by directly helping the parents. That occurred to me because I was at one time as a social worker in McCune Home where juvenile delinquents, the court sent them. And I found kids there that absolutely were never in trouble. The only reason they were there is because nobody, one kid, for example, his mom got off her meds and she was talking to strange voices and stuff, and she couldn't take care of them. So I think that is so important to to focus on the parent as well. And I wanted to highlight the Colorado Springs foster care program as a model. It provides ongoing workshops and a group support groups that are led by professionals.
You do the foster parents?
Yes, foster parents. Yes, absolutely. And the foster parents who have been in the program and have been successful mentor the new ones coming in, and the foster parents start running their own groups, and they provide respite care for each other. If a particular foster parent is having a lot of problems with a teenager or something, they try to assist, and they are kind of a self-help to each, and they take ownership of the program and they provide input, and it's just a marvelous program. And
support groups are very important, and we've seen that in other aspects of parenting and raising children with different needs.
And there's a good, strong mental health component in it too. There's a connection there, and there's services. And
I wonder, may I interject?
Sure. Oh, absolutely. Yeah.
A few years ago, the General Assembly was able to get funding, and this actually was a recommendation out of the Commission on Youth. We were able to get funding to ensure that before a child was actually sentenced to a detention facility or a group facility in the juvenile justice system, that a full mental health evaluation and follow-up treatment was mandated.
Yeah.
And
that would be important. Yeah.
The different court systems worked with either a CSB or a contracted mental health professional, but we thought that was absolutely critical. And I'm wondering, we don't have a requirement that I'm aware of, and I will turn to Rebekah on this. We don't have a requirement that a child entering foster care be offered a mental health evaluation or the supporting services that would go along with a trauma-informed care model?
Sure, there is no actual requirement for that. I will say that most children, all children who enter the foster care system qualify for Medicaid through the Department of Medical Assistance Services. And most of these children, especially those over the age of 5, most of these children are immediately scheduled for a psychological evaluation, and we do try and connect them with services as quickly as possible. But I think you bring up a good point that that is not mandated. And I also think Amy's point of making sure the providers that we are using are trauma informed could be a step in the right direction in terms of connecting children with not only just services, but the right services that will actually be proven to help them long term.
I think that's a great point. And the state, of course, does write the contract with our Medicaid providers. And we want to make sure that our children are not just given psychotropic drugs because it's easy and their behavior is, may appear to be out of the ordinary. They just went through a very traumatic experience. So maybe acting a little out of the ordinary is actually a normal response. And you don't want our children given psychotropic drugs or any drugs that they don't need, which, sometimes tends to be the default. But I'm certainly going to go back. I think that is an action step here, talking about the evaluation, maybe requiring a trauma-informed evaluation, and having trauma-informed professionals, trauma-informed trained professionals actually do the evaluation under our Medicaid foster care contract.
Senator, I second that wholeheartedly, because not every jurisdiction operates the same and has the same models that automatically has children, when they come into the system, have that psychological evaluation. So it's not an automatic. It depends on the jurisdiction and the practices in that jurisdiction. So having something where they were, where it was written into code, or it's something that was policy, that even just for X amount of sessions that they had that evaluation, so that that trauma-informed person, that clinician, could identify some potential concerns, but more than anything, to help that child understand what's happening and process those feelings that they're having, and cope with the challenges that they're facing, because not all kids will speak out, not all kids will act out, but there's a lot going on in their minds at that time, and understanding and having that person who is trained to provide that mechanism and those tools to help them navigate this is critical. And I think that would be
that is
wonderful.
something I really want to move forward with, and maybe a few of you can get together and give me some language that I will move forward with quickly, like within the next week.
Can I interject?
Yes, Tiffany, please jump in.
I strongly advise that there be some education and awareness around mental health diagnoses and things of that nature, because although I know that blanketing a evaluation may come from a good intent or space, it may have a disparate impact on children of minority, especially because those labels are heavy once you do actually place them on youth. So I just want you all to think through that. I'm not saying that it's not a good concept. I just want to identify that it will, right now, because it is optional, there is a disparate impact on youth of color. And then once you make it mandatory, the people who would be highly impacted by those labels are youth of color. So
it's a very excellent point. And I certainly, the intent here is not to label at all. The intent is to provide support, but you make an excellent point. So thank you so much for jumping in on that. Very great point. Mr. Horsch, go ahead. I just thought the conversation needed to flesh out a little bit your point on mental health.
Well, I think the important thing is to emphasize as soon as the child goes into foster care that the day they enter, you should start planning for their going back to the family. And I just want to emphasize the importance of working with the family. And I just saw a program by Lucky Severinsen on NPR, and he covered a program. He did an in-depth coverage of it, filmed it, where the women are doing hard time for very serious crimes, but he reported that every woman in that prison had children. They were all moms. And they bring all these little kids to see their moms. And, we have to really focus on the family reintegration and solitary, in foster care and in all our programs.
Let me stop you right there. There seems to be a movement on maybe enabling any mother, not just a low-income mother, but any mother who actually is willing to accept sort of at-home visits. They call them nurse partnerships. So any mother willing to accept at-home visits for the first maybe 3 to 6 months of the young child's life, parenting skills and other supports can be provided. There's some data out that this actually does help stabilize families, can prevent some child abuse, and maybe in the long run could prevent children from entering the foster care system. I would like our experts to sort of comment on that. Oh, Casey?
Sure, I'll go ahead with that one. And I also want to point out that home visiting is very much tied into preventing child fatalities. And we consistently see, I do sit on a child fatality review team, and we consistently see that many of the fatalities could have been prevented with education about safe sleep. Something as simple as making sure a family has a crib or a safe place for that infant to sleep. And I will say, I believe it's the VCU health system that piloted this program and offered the home visiting service to all families, all mothers who gave birth during a certain period of time. And I believe the research so far is having some pretty positive outcomes, but they're going to follow these kids longitudinally to see about their grades.
That's really great.
Yeah. So I think you're on the right track with that home visiting model.
Super. I am going to try to get funding for that. So maybe that's something we can all, get behind. Casey, did you want to comment on that?
Yeah, I think that's absolutely something that's necessary. I think something that a lot of people don't necessarily realize is that a lot of children that come into care due to neglect and not abuse.
Yeah.
A lot of that can stem from poverty and just lack of skills and lack of knowledge around parenting. And so if we can provide parents and families with those resources on the front end, one, we reduce the trauma that they would suffer from having that neglect or abuse. But also, I think Amy mentioned this, entering foster care is a form of trauma. So sometimes, yes, it's necessary. I don't want to say it's never necessary, but if we can prevent that, if it's a lack of income security or something like that, and we can prevent that and provide the supports to keep the child in the home, that we're automatically reducing the trauma. So I think that we do need to look more and more at providing the supports to the families on the front end. There will certainly always be circumstances where a child needs to still come into care, but there are absolutely circumstances where that's not necessary. And we can prevent a lot of trauma and a lot of heartache if we can just provide those supports on the front end.
Yeah, that's
Ditto.
great. Tiffany, would you like to comment?
Yes, I was gonna say I ditto Cassie on that statement. And I had something else to say, but when you started talking, I lost it. I'll
Oh,
let you
I
know when it comes back.
apologize. Just next time when it comes back to you, just jump right in.
Oh, it did come back to me. It's something very simple. So what I was going to say was that so that we're not penalizing family for their economic status or any of that. So it's my hope is that the goal of the system is to provide permanency, but preventative care will save money, not only save money, but reduce trauma. And when we're talking about young people who do have longer extensive stays, oftentimes it is youth of color who have extensive stays. So how do we make sure that we're not penalizing and associating youth's identity and economic status with their ability to access resources and services and their engagement with the system? Was that clear?
Yes, yes, it was very eloquent. So thank you. Thank you so much. Appreciate your perspective.
There's a lot to, you know, if a child is in foster care because the parent is in prison, there's, you know, they experience a lot of stigmas. Other kids tease them, you know, your mom's in prison and this kind of thing.
Yeah.
And, you know, there's a lot of guilt and fear or anxiety and, you know, nightmares, I guess. I guess I would have nightmares. So,
Yeah.
but I was wondering if you would address, I learned when I was on the Reentry Council that about 60% of the TANF cases are child only. That means they're in relative care. And that's a form of foster care. It's just that they're with relatives.
But it is a diversion from the foster care system.
Yeah.
And I think some of us on this call have been working pretty hard on actually coming up with a funding mechanism for relatives who, you know, take the children. I believe there has to be some kind of an agreement, you know, so there's sort of a shared custody thing, maybe, you know, through the court system.
Well, they need stability.
They need stability, and we have to make financial support available. And I think that gets to Tiffany's point where, you know, a family who may be having a financially rough time or dealing with a drug addiction or whatever the crisis is, you have to believe and hope and provide support services to that family so they can get through that crisis without having the permanent loss of their children. So if the children could thrive with a relative, the state should support that, I think. But I'd like to hear some comments from other. Amy, do you have a view?
Absolutely. The KIN-GAP program is an essential component for us to move forward with that. You're absolutely correct. We want to keep children with family whenever possible. Children do better with family. It's less traumatizing. We can honor their culture that way, their history. But TANF does not provide nearly enough. If you have a sibling group that is coming into care, it's really challenging for any relative, you know, to be able to say, sure, I can take 3 additional kids and be able to care for them with this very low amount of money each month. Yeah. And for some families, that's a barrier because they also know that if it's a grandmother, then that could somehow impact their child, who then, is responsible for that money that went to that is going for TANF, going forward for TANF.
I think the child-only cases on TANF are primarily grandparents raising grandkids.
Yeah.
So
And so
I asked,
Tiffany does have a comment. I think she wants to
Okay, go
interject
ahead.
in here. Tiffany, go ahead.
So what I wanted to interject with saying is that it's not only financial support, but those additional resources that foster parents have access to as well. It's not always just money, although there is a need for money. There's also those wraparound support and
That's right.
resources that'll make those placements successful, and address those economic barriers for those families as well.
Sure, relatives and victim kin need the support systems that you were just talking about, John. Very good point. Thank you. Thank you, Tiffany.
if I could interject, the commissioner, well, one before the current one, told me that because the TANF benefits were so low, the relatives were giving up the kids to foster care, and that's really tragic because the kids are so better off in relative care.
That is very tragic, and we have to work. We have to change that dichotomy. We just have to.
Yeah.
And we're going to work at that. Tiffany, your hand's still up. Did you have another comment? Or
yes. So I'd like to say that that is also true for immigrant families when it comes to accessing TANF resources. I know personally when I, like I mentioned in the chat, when I aged out, I made less than 10K a year. And we all know that that is not enough to support one person, let alone a person with a child. When I went to access resources, I faced many barriers with accessing them because I obtained my legal status so late after being in foster care. It was so close to my 18th birthday. I had to meet all of these requirements to access those financial or economic resources that otherwise would be available to other people. When I did gain access to TANF, it was a child-only case, which still did not speak to the economic disparity in which I was facing. So I just wanted to highlight that the child-only cases do not only apply to kinship family, in those situations, but they do also apply to immigrant families as well.
Sure. Yeah.
Rebekah, do you have a comment on how the system can better support immigrant families? And I guess, Tiffany, you were getting to undocumented immigrants. That was in one of your earlier comments.
Yeah, so I personally,
I was just going to have Rebekah comment on how we can better improve that.
Sure. So the bottom line and what Tiffany, I think is trying to point out is that technically someone who is undocumented cannot be part of what we term the assistance unit. And so they do not receive a cash payment for themselves. The only person who can receive the cash payment is the child who is presumably a citizen. And so that family, just because of that,
I'd like to correct that. Even as a permanent resident, because of how late I received that status, and because of the requirement, I think it's like 5 years or something. I don't know what the year requirement is. Even with legal status, I could not access TANF.
Yes, that is correct. There is a look back period as well. It is for citizens, and which means that families in that situation are not having equal access to the benefits of the TANF program that documented or American citizens have. So that is certainly a system improvement.
I'm going to ask Casey to comment, and then John, you will have just 30 seconds to give us your last thought. So let me go to Casey, and then John, you think about your last thought.
Okay.
Go ahead, Casey.
I am certainly not an expert on undocumented or immigrant children or family. That's what we serve some of that, but it's not my area of expertise. But I will say that I do think that we have a lot of work to do in that area. These are children that still need us, and these are families that still need us. And the more that we can support these families and these children, the better off they will be. Something I wanted to mention earlier, we talk a lot about the statistics and the outcomes of youth who have been in foster care. And I always think it's really important to mention that those are statistics, and it does not mean that youth are doomed to those statistics. When we can provide the supports, youth can excel. They can become incredible contributing members of society and do really amazing things. So I don't want people that aren't familiar with what we're talking about to get too caught up in them, because they're not doomed to it, and they can surpass those statistics. They just need the help of all of us. I know we're talking on the policy level, but it's really a community issue too. And so everyone that's watching this can contribute in some way. We need more foster parents. We need more adoptive parents. We need more mentors for youth who age out of foster care, and all of that, family supports. So it's something that I think we can all come together and support these youth and avoid those statistics.
Oh, that's great. I just want to, for purposes of information, in this last budget that the General Assembly passed, we removed the 40-quarter work requirement for those with a green card. That was a barrier that only a few states had. Virginia was one of them. So we removed that work requirement. So now folks who at least have some documentation will be able to access Medicaid. And we are providing a full range of prenatal services, regardless of the immigration status of the mother. There's an acknowledgement that that baby will be an American citizen and does need care. I think that baby needs care regardless of what the status is. So we actually went forward with that, and we joined many other states. So all of that is good. John, you've got 30 seconds, and then I think
we haven't covered the extended foster care, but
yes, our program's only an hour. I'll have to have another program, I guess.
I just want to make one suggestion. I think is kind of interesting. They're going out on their own, and they need help to prepare resumes and to become self-sufficient. Have we thought about, do they receive, provide them with financial literacy? I would think that is so important. I just hear these stories about people who get their EITC check and buy an old car that's going to just cost them a fortune to fix. And
right, financial literacy is now required as part of the high school curriculum.
Oh, great!
So in public schools,
yeah. Well,
so that has been taken care of, and I will just comment. Tiffany, you wanted to say we needed healthcare access and language access in a more robust way for our foster youth who need those services. Is that a fair statement?
Yes, foster youth. And I want to be mindful when we say immigrant youth, oftentimes that does not cover undocumented youth. So when you said that the 40 quarters was, healthcare access was available regardless of immigration status, does that also include undocumented immigrants who are pregnant as well? Yeah,
on the pregnancy it does.
Okay.
Yeah.
Okay. And which includes postnatal care, correct?
Yes. It's prenatal care and some postnatal care. It's limited on the postnatal care, but it does include, yes. The immigration status of the mother is not a factor now.
And language access was a highlight because that also could impact accessing healthcare services and additional resources, including their educational and workforce development. So language access is really key. I was fortunate to be born from Jamaica, come to America at 2.5. So I don't have as much of a language barrier as other immigrant young people in care. And it's not just the young people in care, it's also the families And we need to take that into consideration when we're speaking about preventative care as well, and not just families who have system involvement, like what children are entered into the foster care system.
Fair enough. Thank you. I am just going to now conclude with what I think our next steps are, and you all can chime in if I missed something important. We certainly heard loud and clear that we're going to have to provide our services in a more culturally sensitive and language sensitive manner. And I think that's a really important theme throughout our conversation. I know that there seems to be a lot of support or acknowledgement by the panel members that home visiting can be very important after the birth of the child. So these nurse partnerships where the mother can connect with a professional who can help with parenting skills and maybe connect that mother to resources that are needed. The other point was we need to look into the appropriateness of providing an assessment of how to provide trauma-informed care to a youth who enters foster care. And I will try to put it in those terms so we get away from any labels, but what does this child need to really, in a trauma-informed a discussion? And I would like to look into that. And third, there seems to be a lot of support for our diversion program, bringing in more relatives, bringing in victim kin, and then providing the supports that are needed, not just financial, but other support mechanisms. Like Tiffany pointed out, these families need to be able to access a range of services. So it's not a panacea. Those are three areas where I think we can move forward with and maybe make some progress. I want to thank each and every one of you for participating. Tiffany Hayes from the Voices for Virginia's Children, thank you so much.
Thank you.
Amy Wilker with the scan of Stop Child Abuse Now in Northern Virginia, and you are the CASA Program Director for Arlington and Alexandria. Thank you again. Rebekah Morgan, you're the Director of the Department of Social Services in Middlesex County and a leader in our Virginia Association of Social Service Directors. Thank you. Casey Cunningham, you're the Policy Director for the Children's Home Society of Virginia. You brought a statewide perspective, and we thank you very much. John Horsch, thank you for your advocacy, and SALT is a wonderful organization. You have represented it well. And I think I have thanked everybody. There's nobody I've left off. I am so proud to have been able to host this. You all are incredibly knowledgeable, passionate, and compassionate people. And I feel better that our foster care system is in really good hands. We need to make improvements, but you all are providing incredibly informed and I think enlightened leadership. I'll make a pitch. If folks want to sign up to be a foster parent, or if they were interested in adopting, where should I have them go, Rebekah? And we'll make sure we put this up in our social media clip.
Sure. They can go to the public website. It is dss.virginia.gov, or they can contact their local Department of Social Services. And I'm sure Cassie will also put in a plug that they can also contact Children's Home Society or another private child placing agency.
Perfect. This video will be available, so you can put it up on social media. I will be promoting it. And again, I thank you on behalf of all Virginians. Thank
Senator,
you so much.
thank you for addressing these issues. Thank you for bringing these issues to the forefront and having this discussion. It's so important, and we really appreciate it. Thank you.
It's been my honor. It's my honor. Thank you.
Excellent.